This is a video that discusses everything you need to know about pain. There's two broad types of pain. One is acute pain, the other is chronic pain. A lot of people say acute pain is immediate pain up till 6 months, and chronic pain is anything after 6 months or longer. However, if you're, for example, a professional athlete or a hypersensitive patient and you have pain for 2 months, in that case it might be considered chronic. So there is chronic and acute pain, and just to be general, we'll say chronic pain is long-lasting and acute pain is short and more immediate pain. So there's three other types of pain, depending upon the source. There's nociceptive pain, which is the common pain that you feel if you sprain your ankle or you go to the dentist and get drilled and it hurts, you skin your knee. Nociceptive pain means it's coming from tissue. There's also neurogenic pain, which is pain coming from nerves. And that's like sciatica, shingles, things of that nature, where the pain is actually emanating from a nerve itself. Now, there's also visceral pain, and that's pain referred from an organ. For example, we all probably have heard of appendicitis, appendix pain. There's cardiac pain that can go down your arm, etc. So that's called visceral pain. So there's nociceptive, there's neurogenic, and there's visceral types of pain. Sometimes we hear pain also referred to as being radiating or radicular. Radiating means it starts in one spot and goes to another, like pain down the leg could be radiating. But if it's from pressure on a nerve, that radiating pain is classified as radicular pain. So there's radiating and radicular. Now, in some cases, and I think this is fairly rare, there's something called psychogenic pain, which means that it's not coming from a real source in the body. It's just pain that is aggravated by some combination of neurons and the brain, and it's increased. So it could be something very mild, but the person, for some reason, elevates it, and that is called psychogenic pain. There's also another type of interesting pain called central mediated pain syndrome. What that means, and I have a number of patients that have this, and what that means is that a very minor seeming injury causes severe pain, and that can be pain that happens from any minor problem. And there's patients where if you touch their hand, they'll say, I feel pain in my head. And that's a real type of pain, they're really feeling pain, and that is from the nerves and the central nervous system. So there's medications that can be used for pain. Obviously, for mild to moderate pain, light therapy, laser therapy are very, very valuable. But for severe pain, usually that requires medication. And probably the most common medication is Tylenol. And Tylenol is acetaminophen, and it's fairly safe, but of course, high doses, long periods of time, it can cause liver damage. And then there's non-steroidal anti-inflammatory drugs like ibuprofen, which is Advil or Motrin, and there's Aleve, which is naproxen sodium. Now, these are great for pain relieving. Some people think that low doses like 200 milligram over-the-counter tablet is going to reduce your inflammation, but it's not great, really. I mean, light is better. But if you get up around 1,500 milligrams, 2,000 milligrams, or 2 grams, you're talking about getting some anti-inflammatory effect. And studies show that if you take large doses of non-steroidal anti-inflammatory drugs compared to light therapy, after 2 months, they're pretty equal in terms of their ability to reduce inflammation. And obviously, light therapy has less side effects because high doses of non-steroidal anti-inflammatory drugs can damage the stomach. For severe pain, there's opioids and synthetic opioids, but obviously the problem with these is they're very addictive and have significant side effects.